Hey, Dr. C here with you. So what does it mean when you feel like something's wrong, but the tests say that you're normal? Maybe they even say that you're optimal. They suggest that nothing is wrong with the thyroid. This is super frustrating, and this is a point in which some doctors just ignore labs altogether and start to adjust medication based on symptoms. They assume that if you have symptoms like you're tired or you're losing hair or if weight's a struggle, it means that you need more thyroid. And in some cases, more thyroid can help, but it doesn't always last if that's not the real culprit. So here's some insights that might help you sort through this. As a generalization, you can have symptoms from your thyroid, either direction, any symptom. What I mean by that is your labs might suggest that you're getting too much hormone, and you can feel like you're getting too little. So too much thyroid can feel like too little. It can make you feel tired. It can make weight gain easier. It can contribute to hair loss. It can cause all these issues. And vice versa happens also. People can have too little and feel like they're getting too much. So some can feel anxious when they're hypothyroid, or they can have their heart racing from that, or they can have symptoms of like sweats or tremors. So it can happen. And I've learned never to assume that someone has too much or too little based on their symptoms. Something is wrong. So if you've got symptoms, they're real, and your doctor wants to work with you to help fix that. That's their job. So your symptoms are real, you're experiencing them, and there they are. But we can't assume that they mean you need more or less thyroid. And we can't even assume that they're tied to your thyroid. So we'll talk about all that. Now, thyroid hormones, what happens is there's how much your body has and how your body uses them. And if you don't use them well, even having the right amounts won't resolve the symptoms. And we call this the resistance to thyroid hormone, or the issues with peripheral activation. And this doesn't always show up based upon things like T3, reverse T3, TSH, but we know that it's relevant when the symptoms came on when thyroid disease came on. Then we think that these symptoms are thyroid related. So what do you do if you've got resistance? The biggest single factor is your ongoing iodine intake. And if there was an iodine excess and it's still present, that's one of the simplest things that makes your body thyroid hormone resistant. So please be aware of the steps in the thyroid reset diet, and please work to get in that green light reset range. And once you've been there for 2-3 months, you should see that those resistance type issues can go away. They can just stop. A really common cycle people get stuck into is that they're getting perhaps a little too much thyroid hormone, but they feel like they're getting too little. And they're tired. And the TSH is just below range or on the bottom end of range. And yet they're given more thyroid hormone. Now, for the first couple weeks, maybe 4 to 6 weeks, they can feel better and feel like that really resolved the problem. But it tends not to last, and the symptoms tend to come back again. And sometimes raising the dose again can help things again for a little while. But what's going on behind the scenes is that your body is resisting, due to iodine or just due to too much hormone. And once you add more hormone in, you temporarily overcome that resistance. But the resistance comes back stronger. Your body fights harder. So it really does take getting deep into those hidden iodine sources and getting to that range low enough to help. So first big step when your symptoms are not explained is regulating iodine, getting that to a good, safe range. Second step is making sure your thyroid levels are optimal, because if you're getting too much, you can feel like you're getting too little. If you're getting too little, you can feel like you're getting too much. So yeah, don't assume that the symptoms are the same direction as you might think. Now, the third step is types of medication. There are many to where their symptoms are not resolved unless you're getting a full spectrum of active thyroid hormones. That includes T4, T3, and T2. We need all of those. So that's a simple case for natural desiccated thyroid. If someone has good blood levels, but they're taking a T4 only, or a T4 and a T3, sometimes they'll do better just by changing to a more complete version of thyroid medication. In terms of approximate comparisons, 100 micrograms of T4 is about the same as a 1 grain dose of natural desiccated thyroid. But the conversion steps do have to be individualized. There are those to where, let's say they're on 100 micrograms of T4, that's a good amount, but it's not controlling their symptoms. They may not need 1 grain. They might need half a grain, 3/4 of a grain. They might need 1 1/4, 1.5 grains, but they're probably not going to need 1/4 grain or 2 grains. They're going to be somewhere over there. It's usually going to be close to 1 grain, but what I always do is err a little less and retest and adjust. It's hard on your body to get too much. It's no fun to get too little, but it's dangerous to get too much. So err low, test, adjust, get it right for you. Now the 4th step, I call these the comorbidities. These are the other diseases that are not thyroid disease. However, they're more common in those who have thyroid disease. And that can be because they just show up in the same people, per age and gender. It can be because they show up for someone who has autoimmune thyroid disease. They're more apt to have other autoimmune diseases. Or they can be the result of abnormal thyroid hormones. So all those 3 reasons make it really common to have other conditions. This can include things like celiac disease, autoimmune gastritis, hyperparathyroidism, latent iron depletions, sleep apnea. We've got about 15 different conditions, any one of which there's more than a 5% likelihood of having if you've got thyroid disease. And I see these things missed all the time. And the difficulty is doctors assume that the one problem has got to be the thyroid levels. And that's not always the problem. So if you don't identify and correct the comorbidities, things won't get all the way better, but they are there and they can be helped with. So yeah, if you don't feel well and your symptoms don't align with your labs, please know that maybe they just won't, because that happens. Symptoms of too little can be from getting too much. It may be because you're not at a good optimal range for your labs. It may be because you're not getting a full spectrum of thyroid hormones, or it may be because there's some hidden condition that's not yet diagnosed. Okay, Dr. C with you. Take great care, and I'll see you real soon.